You're feeling down. How do you know if you have depression and need medications for your mood? Well, if you've been struggling with your mood for a long time, it's very important to know if you have depression, which is a medical condition, or discouragement, which is part of just being human. You see, depression is a chemical imbalance that needs medications to restore the serotonin level. But discouragement is a normal phase of life that either clears with time or with the help of a counselor. Well, it's really important to separate the two because the treatments are so different. The problem is we don't have an objective medical test like an x-ray or a blood test to tell who has the chemical imbalance and who's just discouraged. The diagnosis is based on interviews and a checklist of symptoms, so it's not an exact science. But let me give you an easy to understand way to separate discouragement from depression. Well, the first thing to know about discouragement, which is normal human downness, which we all have, is that it usually is transient. It comes and goes, it has an obvious cause that triggers it, and usually with time it passes. And when you're discouraged, you can enjoy other activities. So you may be discouraged about work, but you're okay at home, or discouraged about home, but you're okay at work. So there is a part of your life where you're feeling down, but the rest of your life you're feeling okay. When you're discouraged, you can still enjoy other activities which are unrelated to the area of your life where you're feeling down. In discouragement, you still feel spiritually stable. You still feel your connection with God. You still feel that life is worth living, but there's a part of your life where you're unhappy. But the most important thing about discouragement is you can still control your thoughts and you can still concentrate. Now with depression, it's quite different. It's usually very prolonged. Most of the people who came to see me with depression had symptoms for at least 20 years. They usually came to see me in their 40s and they traced their down times right back to their teens. So it's usually a very prolonged condition. Now, it's not always severe, but most people told me that it was just a very gradual slide and each year they just got a little bit lower and just had more and more struggle. Also too, in depression, there's a sense of a loss of interest in everything. Not just a part of your life is affected, everything is affected. So you can't get away from that lowness. There's every part of your life you're struggling and sagging. There's a sense of hopelessness. You really do feel cut off from God. Your spiritual life just disappears and you do feel that life just isn't worth living, and you may even feel that God has abandoned you. But the most important symptoms to tell if it's a chemical imbalance is you can't shut your mind off and you can't concentrate for a long time, like months or years. And that's the sign that medicines can help, because the purpose of medicines is to restore thought control and to restore concentration so you can have a clear mind once again. And another method that you can use to tell if you have a chemical imbalance and need to see a doctor is to go and use the tools that are on our website. So just go into the homepage of drgrantmullen.com and click on the button, Am I Normal? And that will take you to the checklist of symptoms of mood disorder. So go through each one of the checklists and see if the symptoms you're experiencing are the same ones on the checklist. And if you do have enough of those symptoms, print out the checklist and take that to your doctor, because that will give the doctor all the information he needs to know if you need to start medications. So it's not that difficult to separate depression from discouragement. You just need to know how to use the tools. So if you're feeling down most of the time, don't stay that way. See a doctor or a counselor, and there's lots of information on my website, and get the joy back into your life. Don't leave yourself the way you are now.